Don't let joint pain hold you back. Imagine restoring movement and getting back the life you love faster. I'm Dr. Adrian Lee, Chief Medical Officer at the Regenerative Medicine Institute of Canada, or RMIC. We're pioneering a new way to treat joint degeneration and osteoarthritis, one built on science, safety, and results. Regenerative matrix therapy is a minimally invasive biologic treatment that uses a small sample of your own purified adipose or fat tissue. By reintroducing this biologically rich, purified tissue into damaged areas, it can support repair, reduce inflammation, and even reverse disease processes directly at the source. Regenerative matrix therapy is designed for people with persistent pain, especially joint pain, that limits mobility and quality of life. If you've tried physiotherapy, other injections, or medications and still find daily activities difficult, and you want to stay active, avoid surgery, or simply enjoy life without constant pain, this could be for you. It all starts with a medical evaluation to confirm if you're a candidate. Step 1 is a personalized consultation to review your symptoms and your imaging. Step 2, on treatment day, a small amount of fat is collected under local anesthesia. Step 3, we process and purify the fat tissue using our proprietary Precision Adipose Modulation method. Step 4, the purified fat tissue is precisely injected into the affected area or joint. In select cases, your physician may combine the treatment with platelet-rich plasma to complement the biologic effect. It's a walk-in, walk-out procedure. Most people notice only mild soreness or swelling at the collection or injection sites for a few days. After the procedure, you'll leave with a personalized recovery plan tailored to your activities. Most patients return to routine activities within a day or two. Our protocol is the only advanced orthobiologic or regenerative medicine treatment of its kind to be reviewed by Health Canada with no objection. Every treatment is delivered by qualified and licensed physicians using a standardized process to ensure safety and consistency. Many patients report improved mobility and reduced pain within weeks, and benefits can last many years. Each case is different. Research shows this type of approach can improve pain and function to provide long-term relief in degenerative joints. In fact, 40 clinical trials have demonstrated that this type of therapy can reduce pain from knee arthritis by 50% 1 year after a single injection. One study actually showed that almost 70% of patients had relief that lasted over 4 years. For many, that means delaying or avoiding surgery altogether and returning to an active life sooner. Results vary, but clinical studies and patient experience both point to lasting improvements. If joint pain is holding you back, start your personalized consultation today and see if regenerative matrix therapy is right for you.